If you've been getting up 3, 4, sometimes 5 times every single night just to urinate, if your stream has gotten so weak you have to stand there waiting, wondering if you're actually done, if you feel like your bladder never fully empties no matter how long you try, I need you to understand something that's going to change everything. Your prostate isn't the real problem here. The real problem, the one nobody's explaining to you clearly, is sitting on your kitchen counter right now. I'm Dr. Natalia Parker, and I'm going to show you exactly what's happening. There are 3 foods, just 3, that millions of men over 60 eat every single day thinking they're harmless, even healthy, while those foods are quietly creating inflammation that's squeezing your prostate, weakening your bladder, and destroying your quality of life so gradually you don't notice until it's already serious. And here's what makes this dangerous. You probably had one of these foods for breakfast this morning. You'll probably have another one tonight unless you know what to look for. But before I tell you which 3 foods are attacking your prostate right now, you need to understand why this matters so much. Because men who remove these specific foods start sleeping through the night again within weeks, they get their stream strength back, they stop having those embarrassing leaks, they feel like they're in control of their own body again, and it all starts with knowing what you're putting in your mouth. Now, your prostate doesn't just grow for no reason, it's not simply age or bad luck. What's happening inside your body is a very specific biochemical process, and that process is directly influenced by what you eat. Every single time you sit down to eat, every time you open your refrigerator, you're making a choice that either feeds prostate inflammation or fights it, and most men have no idea they're choosing wrong. Let me explain how this works. Your prostate is a small gland that wraps around your urethra, the tube that carries urine out of your body. After 60, that gland can start growing. When it grows, it squeezes the urethra. Think of it like putting your hand around a garden hose. Water still comes out, but weaker, with more effort. That explains the weak stream, the feeling that you never fully empty, the constant urgency. But here's the critical part. That growth isn't inevitable. The process can be accelerated or slowed depending on 3 key factors. First factor is chronic inflammation. Second is your metabolic health, meaning how your body processes sugar, fat, and hormones. Third is direct irritation of your bladder and urinary tract. And now here's what changes everything. The 3 foods I'm about to reveal attack exactly those 3 weak points. One triggers systemic inflammation throughout your entire body and makes your prostate react by growing. Another disrupts your hormonal and metabolic balance in a way that favors prostate enlargement. And the third directly irritates your bladder, making you feel urgent even when there's barely any urine accumulated. Do you see why this is so critical? It's not one mechanism, it's 3 simultaneous attacks on your prostate. And the most serious part is that most men are consuming all 3 foods at the same time, every single day, without knowing it. Think about this for a second. How many times have doctors told you that prostate problems are just normal at your age? How many times have they made you feel like there's nothing you can do except wait for it to get worse and eventually need medication or surgery? That narrative is incomplete. Because yes, age plays a role, but diet also plays a role. And diet is something you control. Every day, 3 times a day, you have the power to make decisions that improve your prostate or damage it further. And here's the evidence. Recent medical studies have demonstrated a direct relationship between certain dietary patterns and worsening prostate symptoms. Men with metabolic syndrome, meaning abdominal obesity, insulin resistance, high triglycerides, and elevated blood pressure, have a significantly higher risk of developing benign prostatic hyperplasia and severe urinary symptoms. And you know what causes metabolic syndrome? The exact same foods I'm about to reveal in just a moment. This means if you improve your metabolism, if you reduce inflammation in your body, you automatically reduce pressure on your prostate. It's not magic, it's biology. It's cause and effect. Now let's get to the specifics. Let's talk about the 3 real enemies of your prostate, and I'm going to explain not just what they are, but how they act, what they do inside your body, and why they're so dangerous. Because understanding the mechanism is what's going to give you the motivation to change. The first enemy, and probably the most surprising for many men, is sugar. But not just any sugar. I'm talking specifically about added sugars, about high fructose corn syrup that's hidden in sodas, in commercial juices, in cookies, in sweet breads, in processed sauces. I'm talking about that soda you drink every day after lunch, that bottled orange juice you think is healthy, those desserts you eat without thinking. Let me explain what happens when you consume large amounts of fructose. Fructose is metabolized primarily in your liver, and that process generates systemic inflammation. It produces inflammatory molecules that travel throughout your entire body and reach your prostate. When your prostate is constantly bathed in inflammation, it starts reacting. It grows, it swells, it squeezes the urethra. Additionally, fructose promotes insulin resistance, and insulin resistance is directly related to higher levels of growth factors that make your prostate increase in size. See how everything's connected? It's not just one thing, it's a domino effect. You eat sugar, you generate inflammation, you alter your hormones, and your prostate pays the price. And here's the worst part. Animal studies have shown that high fructose diets cause direct inflammatory infiltration in prostate tissue. In humans, chronic consumption of sugary drinks has been associated with higher risk of metabolic syndrome, which in turn increases the probability of serious prostate problems. So, if you're drinking 2 sodas a day, if you're having cereal with processed juice for breakfast, if you're eating sweet bread in the afternoon, you are literally feeding the problem. You're pouring gasoline on the fire of prostate inflammation. And the most frustrating part is many men think they're making healthy choices. They think fruit juice is good. But if that juice is industrial, it's loaded with concentrated fructose without the fiber that moderates absorption. It's almost as harmful as soda. Now, what can you do? It's very simple. Eliminate sugary drinks completely. Replace them with water and lemon, with unsweetened green tea. If you want something sweet, eat whole fruit with its natural fiber. Blueberries, strawberries, apples. The fiber makes the sugar absorb slowly and doesn't cause the same metabolic damage. Men who have made just this one change, eliminating sodas and processed juices, have reported to me in consultation that within 2 or 3 weeks, they already notice less urinary urgency and fewer nighttime wake-ups, because they're removing the fuel from the inflammation. But wait, sugar isn't the only enemy. There are 2 more that are just as dangerous, and they're probably in your refrigerator right now. Before I continue, I want you to know something. These changes work, but they work better when you have a clear structure to follow. When you know exactly what to eat, what to avoid, and how to implement everything without confusion. But I'll give you all those practical details in just a moment. First, let me show you the second enemy, because this one surprises almost everyone. The second enemy is actually a block of foods that many men consume daily without questioning it. I'm talking about full-fat dairy products, especially fatty cheeses, whole milk, cream, ice cream, and also processed meats, cold cuts, sausages, hams, smoked meats. Let me explain what's happening here. Dairy products rich in fat and calcium have been associated in multiple studies with a modest but consistent increase in the risk of prostate problems. Why? Because they influence the levels of a growth factor called IGF-1, which is like fertilizer for your prostate cells. More IGF-1 means more prostate growth. Additionally, the saturated fats abundant in cheeses, whole milk, and fatty red meats promote metabolic inflammation. And you already know what inflammation does. Now let's talk about processed meats. When you process meat, when you smoke it, when you cure it with nitrites, when you cook it at high temperatures, chemical compounds form called heterocyclic amines and polycyclic aromatic hydrocarbons. These compounds have been linked in scientific literature to higher risk of prostate alterations. I'm not saying one occasional sausage is going to ruin your life. I'm saying that daily, habitual, chronic consumption of cold cuts and processed meats builds an inflammatory environment in your body that your prostate cannot ignore. And there's another critical factor here. These foods, especially when consumed in excess, promote abdominal obesity. And abdominal fat isn't just aesthetic, it's metabolically active. It produces inflammatory hormones, alters the balance between testosterone and estrogen, and contributes directly to worsening prostate symptoms. So, what should you do? Reduce consumption of full-fat dairy. If you drink milk, choose low-fat options or plant-based alternatives without added sugars. Moderate cheese. Don't eliminate it if you like it, but don't eat cheese every day in large quantities. And as for processed meats, eliminate them as much as possible. Replace them with omega-3 rich fish like salmon, sardines, mackerel. These fish have anti-inflammatory fats that do exactly the opposite. They protect your prostate instead of damaging it. Incorporate more legumes, more lentils, more chickpeas as protein sources. Use olive oil instead of butter. Eat avocado. Eat nuts. This change doesn't just improve your prostate. It improves your heart, your blood pressure, your body weight. It's a multiple victory. But there's still the third enemy, and this one is the most immediate. This is the one you can notice within hours. This is the one behind those sudden urges, those embarrassing leaks, those nights when you get up every 2 hours unable to rest. Leave a comment below and tell me which of these 3 foods you're consuming right now because I want to know where you're starting from. Are you drinking soda daily? Eating processed meats? Let me know. The third enemy of your prostate is caffeine and alcohol. And I know many men don't want to hear this because morning coffee is sacred, because the weekend beer is part of the routine. But let me explain what's really happening. Caffeine is a nervous system stimulant, and one of its actions is to increase your bladder's sensitivity. What that means in practical terms is your bladder feels the need to empty faster. Even when it's not actually full, it's like lowering the tolerance threshold. So you drink coffee, and 30 minutes later, you feel urgency. You drink more coffee in the afternoon, and by nighttime your bladder is hypersensitive. You lie down and any minimal amount of urine wakes you up. Clinical urology guidelines recommend reducing caffeine as one of the first conservative measures to control overactive bladder symptoms and urinary frequency. This isn't my opinion, it's standard medical protocol. And it works. Patients who reduce their coffee consumption from 4 cups a day to 1 cup in the morning report dramatic improvements in urgency and nighttime bathroom trips. It's one of the fastest changes you can experience. Now let's talk about alcohol. Alcohol has 2 negative effects on your bladder and prostate. First, it's a diuretic. It makes you produce more urine. Second, it directly irritates the bladder. So if you drink alcohol at night, you're going to wake up more times to urinate. And if you already have an enlarged prostate compressing the urethra, that combination is disastrous. What to do here? Limit coffee to 1 cup in the morning. Avoid energy drinks completely. They're loaded with caffeine and sugar, the 2 worst enemies together. Reduce alcohol, especially at night. If you want something warm, try decaf tea, herbal infusions, or simply warm water with lemon. This change alone can reduce your nighttime wake-ups by half within days. And when you start sleeping all night without interruptions, your quality of life improves radically. Now let me show you how all of this looks in real life. Because one thing is theory, and another thing is what happens with real men when they make these changes. I had a 64-year-old patient who came to my office completely resigned. He told me, "Doctor, I've accepted this is just part of getting old." He was getting up 5 times every night. His wife was sleeping in another room because the constant back and forth wouldn't let her rest. When we reviewed his diet, we found he was drinking 2 large sodas every day, one with lunch and another in the afternoon. He was having sweet bread with very strong coffee for breakfast, eating cold cuts almost daily, and drinking beer 3 or 4 nights a week. I proposed a simple change. Eliminate sodas and replace them with water. Reduce coffee to 1 cup in the morning. Change cold cuts for grilled chicken or fish. Save alcohol for special occasions. In 3 weeks, he came back. His nighttime wake-ups had dropped from 5 to 2. He told me his wife had returned to sleeping in the same room and that he felt more energetic during the day because he was finally resting. Another case. A 68-year-old man with recurrent prostatitis. Every 2 or 3 months, he'd have infections. He was frustrated, tired of antibiotics. His diet included cheese in almost every meal, red meat daily, and very few vegetables. I suggested incorporating fish twice a week, increasing vegetables, moderating cheese, and adding antioxidant fruits like blueberries and pomegranate. Within 2 months, he didn't have a single new infection. His urinary flow improved noticeably, and he told me something I'll never forget. Doctor, if I had known that something as simple as changing what I eat could make this much difference, I would have done it years ago. And that's exactly the point. The right information applied with consistency changes lives. Now I want to give you a practical plan, something you can start today and follow for the next 30 days. Because knowing what to do means nothing if you don't have a clear action plan. First week. Your only mission is to eliminate sugary drinks. Replace sodas and industrial juices with water, water with lemon, or unsweetened green tea. Reduce your coffee to 1 cup in the morning, and every day eat 1 serving of low-sugar fruits, blueberries, strawberries, apples. That's it. Don't try to change everything at once. Just focus on this for 7 days. Second week. Now eliminate processed meats. No cold cuts, sausages, ham. Replace them with fish, with chicken, with legumes. Introduce fish at least twice this week. Continue with the changes from the first week. Third week, incorporate anti-inflammatory foods. Add 1 serving of avocado daily. Eat a handful of nuts, walnuts, or almonds. Use olive oil in your salads. Practice conscious hydration. Drink water during the day, but reduce consumption 2 hours before bed so you don't wake up as much at night. Fourth week. Add gentle exercise. Walk 20 minutes a day, and if you can, practice pelvic floor exercises, also called Kegel exercises. These strengthen the muscles that control the bladder and improve urinary control. At the end of these 30 days, evaluate. How many times are you getting up at night now compared to before? Does your stream have more strength? Do you feel less urgency? Do you have fewer leaks? If the answer is yes, then you know you're on the right path. And if after 30 days you don't see improvement, or if your symptoms worsen, then it's time to see your urologist for a complete evaluation, because these changes are powerful, but they don't replace professional medical diagnosis. Now, there's something very important I need to clarify. Everything I've explained in this video is based on scientific evidence and my clinical experience treating men with prostate problems for years. But these measures are preventive and conservative. They don't substitute medical treatment. If you have blood in your urine, intense pain when urinating, fever, total inability to urinate, or sudden loss of bladder control, you must go to the emergency room immediately. These are alarm signs that require urgent medical attention. If you have a history of prostate cancer, if you're under oncological treatment, if your PSA is elevated, talk to your specialist before making drastic changes in your diet. Because in certain cases, nutritional adjustments must be supervised. But for most men with mild to moderate symptoms, these dietary changes are safe, effective, and can make an enormous difference in your quality of life. Men, listening to this until now is already an act of courage, because it means you haven't resigned yourself. You haven't accepted that your prostate controls you. You're willing to make decisions that improve your future. And that deserves recognition. Now here's the truth. The real enemy of your prostate isn't hidden in some mysterious place. It's on your table, it's in your refrigerator, it's in the habits you repeat every day without thinking about them. But the good news, the news that changes everything, is that you have the power to change those habits. Eliminate added sugars and industrial drinks. Moderate full-fat dairy and processed meats. Reduce caffeine and alcohol. These aren't complicated decisions. They're simple decisions with profound results. And if you apply the 30-day plan I gave you, if you follow it with discipline and consistency, you're going to start noticing real changes. Less urgency, fewer nighttime wake-ups, more strength in your stream, more control over your body. This isn't an empty promise. It's changing your internal biochemistry so it works in your favor instead of against you. If this video helped you, if you felt like finally someone is explaining the truth to you without beating around the bush, without hidden agendas, give it a like and subscribe to the channel. Because my mission is to give you reliable medical information you can actually use. And if you want me to give you specific recipes in the next video, complete menus for the whole week, and a detailed shopping list so you don't have to guess what to buy at the supermarket, let me know in the comments. Your prostate doesn't define who you are, but the decisions you make today do define how you're going to live tomorrow. Take care of yourself. I'll see you in the next one.